knocking on my patient's door, hand hygiene. Hi sir, what's your name?
Dominic.
Hi Dominic, my name's Lexi. I'm a student nurse. I'm going to be doing an assessment on you today. What brings you in?
I got a wicked headache.
Oh, I'm sorry to hear that. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever experienced in your whole entire life, what would you rate your pain?
It's like a 4.
A 4? Okay. Is it alright if I start an assessment on you?
Yeah.
Okay. Before we begin, I'm just going to ask you to remember 3 words for me. And then at the end of the assessment, I'm going to ask you to remember those 3 words, okay?
Okay.
So the 3 words are going to be plane, ball, and truck. Okay?
Okay.
Alright. So I'm just going to ask you some silly questions, okay? So what's your full name?
Dominic Schmidt.
Awesome. And what's the date today?
May 5th.
Perfect. And so what, I know I already asked you, but what brought you in?
My headache.
Headache? When did that start?
Started about Monday.
Monday? Okay. What were you doing before it started?
Oh, I was out doing some yard work.
Some yard work out in the sun?
Yeah.
Okay, awesome. So my patient is alert and oriented ×3, and his speech is not slurred, and he's responding appropriately to questions. So I would say neurologically he's intact. Okay, I'm just gonna look at your eyes with my pen light here, so just try to look at my finger, okay? Try to keep your eyes nice and wide for me, okay? Perfect. And now just try to follow my light as it comes in, okay? Perfect. So my patient's pupils are equal, round, and reactive to light, and they're also accommodating, so that's good. Alright, now just follow the tip of my pen right here, okay?
Okay.
So my patient's eyes they look normal in all 6 fields of vision. He has no nystagmus or anything like that. Alright, Dominic, I'm just going to sit on the bed here if that's okay with you.
Yeah.
So I'm just going to have my fingers here. You just tell me when you can see them, okay?
Okay. Yeah.
No? Okay. So my patient's peripheral vision is intact, so that's awesome. And then just looking at his eyes, I didn't mention it before, but they look symmetrical, no drainage or lesions or anything abnormal noted like that. Alright, so now I'm just gonna feel your head, is that okay?
Yeah.
Alright, just tell me if you have any pain or anything, okay?
Okay.
Any pain?
No.
Okay. And then, so as I was feeling his head, I was also looking. He doesn't have any like critters or lesions or anything abnormal in his hair or on the scalp. And also he doesn't have any pain, and I didn't note any deformities or anything abnormal there. So now I'm going to go down to the ears, and I'm going to check his ears. So I'm going to start by looking at them. Alright, I don't know any lesions or drainage, nothing abnormal. Alright, I'm gonna pull on your ears. You tell me if you have any pain.
Okay.
Any pain there?
Nope.
How about that?
Nope.
Alright, so pulling on the pinna and pushing on the tragus. My patient doesn't have any pain, so that's good. Alright, let's see. I'm gonna look at your, I'm gonna do the whisper test. So I'm just gonna have you close one ear, and I'm gonna whisper a word, and you tell me if you can hear it, okay?
Yeah.
What did I say?
Apple.
Okay, perfect. I'm gonna come around on the other side here. So close that other ear for me.
Yeah.
What did I say?
Baseball.
Okay, perfect. Alright. So my patient was able to hear both words that I said. So I don't have any indication that he is losing his hearing or anything like that. Alright, so looking at the nose, it looks symmetrical, no deformities, no drainage, any abnormalities. Dominic, I'm just going to have you tilt your head up for me. Alright. I don't know any polyps or septal deviation or any deformities. Nothing abnormal noted there. Dominic, can you just open your mouth for me and say ah? Perfect. Again, no lesions noted. The mucosal membranes look pink and moist, and the tonsils and the soft palate rise equal and bilaterally. So coming down, I'm looking. I don't know any JVD. The trachea looks midline. I'm gonna palpate.
Yeah.
Any pain noted?
Nope.
Okay. Alright. Again, the trachea still feels midline, no deviation, no pain noted there. And then I'm gonna palpate your lymph nodes. Have you sit up for me a little bit? So I'm getting the one that's just right behind his head here. Okay, I'm gonna come down. Alright, any pain?
No.
Okay, so none of his lymph nodes are swollen and they're non-tender, so that is good. And I'm just gonna palpate your face, your sinuses here. Any pain there?
No.
Good. So no pain in the sinuses or the lymph nodes. And I don't feel any inflammation or anything like that. Alright. And I'm gonna come around here and I'm gonna feel your pulse. Awesome. He has an equal and regular rhythm +2 strength. And so I'm just going to go ahead and take a listen to that. I'm just going to have you take a nice deep breath and hold it for me.
Yep.
Alright. And then one more time on this side. Awesome. So don't know any bruise or murmurs or anything like that. So that sounds nice and good, clear there. All right, and I'm just gonna feel your thyroid. Okay, so if you could just sit up for me. Okay. So I'm just gonna come around here. Take a nice big swallow. Perfect. So I feel that move up and down. So that is good. I'm just gonna push it to the side a little bit. Good. You can sit back. So I don't feel any masses or anything like that. So that feels nice and regular. Now, Dominic, I'm just gonna listen to your heart sounds, okay? So you can just breathe normally.
Okay.
Typically, I would expose the area for any inspection or listening, but for this video, I'm just gonna leave him how he is. So all 5 areas sound good. S1 and S2 are noted, and no murmurs, rubs, gallops, anything abnormal there. So I'm just gonna listen to your lung sounds now, Dominic. Just take a deep breath each time I move the stethoscope, okay?
Yep.
have you sit forward. Perfect. Alright. So the lung sounds are clear and equal bilaterally. Alright, and can I just have you squeeze my hands? Perfect. So he has equal strength bilaterally in the upper extremities. And I'm just going to look at your fingers here. I'm going to look at this one. Alright, the nails look good. Cap refill less than 2 seconds. Pulses are equal and regular rhythm plus 2 strength. And Dominic, I'm just going to have you lay down for me for a minute.
Yep.
Alright, while you're doing that, and the skin is pink, warm, and dry. No tenting, so that looks good. And no lesions or skin breakdown that I've noted. Again, I would expose him so that I could see all of the skin to make sure there's no lesions or skin breakdown or any abnormalities throughout the entire body. Dominic, I'm just going to listen to your stomach if that's all right.
Yep.
First, I would inspect, make sure there's no masses, any distension. Doesn't look like there's any abdominal distension from what I can see. We'll start by listening. Bowel sounds are intact and normal active, which is good. Have you had any abdominal pain lately?
No.
Okay. So I'm just going to press on your belly. You tell me if you have any pain, okay?
Okay.
Any pain?
No.
Good. So the abdomen is soft and non-tender. It's not rigid, he's not guarding, and I don't know any masses or any abnormalities, nothing like that. So that's good. Dominic, I'll just have you sit back up, okay? Alright. And I'm just going to take your socks off, if that's alright.
Yep.
Alright. So just starting, looking at the nails, they look good. No spooning or clubbing, same with his fingernails, no abnormalities, nothing noted in the nails. Cap refills less than 2 seconds, so that's good. I'm going to start by feeling the pulses. Good. Nice strong pulses, +2, regular rate and rhythm. Feel these ones. Tibial pulses. Good. Regular rate and rhythm +2 strength. Okay, I'm gonna have you push down on my hands. Good. Push up. Awesome. Equal strength bilaterally. Okay, now Dominic, I'm gonna have you close your eyes for me, okay?
Yep.
Where am I touching you?
My left arm.
Where am I touching you now?
My right leg.
Perfect. How about now?
My left leg.
Okay, how about now?
My right arm.
Awesome. So his sensations are intact in the upper and lower extremities. So then we would go through and do full range of motion in all the extremities, all the joints. For example, Dominic, can you tilt your head to the side? Can you tilt it to the other side? Can you look up to the sky and put your chin to your chest? And can you roll your head in a circle? Good. Any pain there?
No.
Okay, awesome. So I'll have you put your socks back on.
Okay.
Here you go. Alright, and I'm just going to test his fine motor skills. So Dominic, I'm going to have you touch your nose and then touch my finger, okay? Perfect. So his fine motor skills are intact. And then I'm gonna have you sit up on the edge of the bed here.
Okay.
Alright, tell me if you're in any pain, okay? Any pain?
Nope.
Alright, awesome. So he has no pain, and the spine was in line, and I didn't note any deformities or anything like that. Now, Dominic, I'm just going to have you stand up for me, okay? Turn around and face the camera. Alright, and now I'll have you lift your arms up in front of you with your palms up, and close your eyes and count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. So no pronator drift, so that's good. Now I'm going to have you stand with your feet together and put your arms at your side and close your eyes for me. Awesome. You can open your eyes now. Awesome. So he was able to stand there with his feet together, his arms at his side with minimal swaying and not lifting his arms up or spreading his feet for balance. So his balance is intact. Now I'm just going to have you walk one foot in front of the other. And now turn around and come back. Perfect. So he's able to tandem walk with no difficulties. So his gait is intact. Now I'll have you sit back down. Alright. And then I didn't say it before, but looking at his skin, I don't note any edema. And then when he was sitting up, I would also note on his backside, make sure there's no lesions or skin breakdown or anything like that. And Dominic, do you remember those 3 words that I asked you at the beginning? Remember?
Plane, truck, and ball.
Perfect. Awesome. Yeah. So I would now put the 2 side rails up on his bed, make sure he's in the lowest position, and give you your call bells if you need anything, okay? Is there anything else I could do for you?
Nah, I should be all set.
Okay, awesome. Thank you for letting me do an assessment on you today.
Of course.